Hi, this is Dr. Grace Chung from Smile Shop Dental. In this video, you will see how a dental implant is placed in a space where there is a missing tooth. I always start by tapping the area where we're working to ensure that the patient is completely numb. The first step is to expose the bone underneath the gums where the implant is going to be positioned. And this is done by making small incisions on the gums and laying down what is called in surgery a full thickness flap. And I do this so that I can evaluate the bone quality, size, and anatomy, and to overall just see what I'm working with, because sometimes the gums look like there's a lot of bone underneath, but in actuality there's not. And I do keep this flap as minimally invasive as possible, but it does need to be large enough to expose that entire area. Now, this instrument is called a periosteal elevator, and it is used to push the gum tissue back and away from the periosteum, which is the dense layer of connective tissue that envelops the bone. And sometimes this tissue is so dense that it can be difficult to lay that flap down, and I have to reintroduce the scalpel to excise more gingival tissue. And many times I do find that laying down the flap, especially in dense tissue, is more time consuming than actually placing the implant itself. And now that we have that flap, we're ready for our next step. And we're now ready for the pilot hole. This is done with a very sharp burr to make the first osteotomy into the bone. All the rotary instruments are used with a handpiece with plenty of irrigation with sterile saline solution because it runs at a very high RPM. The speed is about 2,000 RPM, and it's so important not to burn the bone. Then I move up a size to a 2.3 millimeter osteotomy burr, and this is drilled to a very shallow depth, about 6 to 8 millimeters into the bone. This allows me to place what is called a parallel pin, and that helps me evaluate where that final crown is going to be, the direction and the placement in between the teeth. So I take an x-ray, I evaluate the space between the teeth, the root structures, and I just want to overall make sure that this is where I want to be. If anything needs correction, this is where that would be done. So now we are enlarging the osteotomy width size, and the drill widths are going to get bigger and bigger as we drill. And these are done to the length of the final implant. Sometimes you can make it a little bit more shallow depending on how dense the bone is, but you can assess that as you start the surgical process. And throughout the process, you will see that the assistant is continually irrigating out the site. And this is important because we want to make sure that the area is free of any debris or bacteria, and we keep everything as sterile as possible. And now I've gone to the final drill size, so I am ready for the placement of the actual implant. And this is an Implant Direct 3.5 millimeter platform implant, and it is placed first with the handpiece at a very slow rotational speed. And I use just a slight little bit of pressure and keeping it as straight as possible. Then I switch over to a hand wrench, and I use this to bring the implant to its final depth. And I like using the hand wrench at the end so that I can actually see where I am in relation to the crest of the bone and which direction that the implant is facing. It makes it a lot easier for the restorative process. Then at the end, we take another x-ray, and this is the final x-ray after placement. And if you notice, the cover screw is actually not engaged all the way down. And I left this up here to show that many times you need to ensure that you're checking your progress. Even if you're confident where it's at, you never know when there's one little thing that could be off. So we will go back in and we tightened up the screw, and all was done. Then we sutured everything up, and we were all set with our procedure. The patient was happy and ready to go home.